Hi, today I will be talking to you about cognitive behavior therapy, which I'll be referring to as CBT. CBT is a therapy approach for addiction counseling. CBT emphasizes what people think rather than what they do. CBT is about understanding and providing insights as to why a person abuses drugs or alcohol in the first place and what it is that drives the compulsion. The physical dependence on illicit substances is not a problem, but rather a serious issue resulting from the constant underlying needs. It is possible to have a patient undergo withdrawals to be completely physically independent from drugs or alcohol, but unless there are strategies in place to ensure that the patient stays sober in the future, a relapse is likely. Patients have to understand how to replace their addictive behaviors with a positive alternative. Cognitive behavior therapy has two key components: skills training and functional analysis. Skills training, this is the step where the patient will begin to unlearn old destructive habits and come up with new and healthier ways to replace these old habits. The reason that the patient may have turned to drugs to deal with intrapersonal or interpersonal issues may include they never having learned effective strategies to deal with challenges that people faced in their adult life, especially those who started substance abuse early during adolescence. Often they have no healthy ideas how to deal with problems, chronic involvement in drug using lifestyles. Drug abuse and other problems may have weakened the ability to use effective strategies that the patient may have learned in the past. Functional analysis, both the therapist and the patient work together to identify circumstances, thoughts, and feelings that the patient experienced before and after he or she uses illicit substances. This will help the patient understand risky behaviors and choices that may potentially lead to relapse, especially during the early treatment phase. This functional analysis is critical. Not only will it identify potential triggers, but also allows patients to understand and avoid high risk situations. It also provides insights as to why the patient turns to drugs or alcohol in the first place. Is it because of achieving euphoria not otherwise available? Is it about escaping from a reality? Perhaps it's about coping with interpersonal difficulties. Regardless the triggers, it is important that both parties come to understand of the issue. CBT, the treatment focuses on changing thoughts in order to adjust psychological and personality problems. The therapist assists the patient in identifying specific cognitive assessments and biases in thinking and provides guidance on how to change the client's thinking. It also helps the patient to learn effective self help skills. CBT, cognitive therapist, believes that it is dysfunctional thinking that leads to dysfunctional emotions or behaviors. By changing the patient's thoughts, they can change how they feel and what they do. The way CBT works is a client learns to disassemble problems into various parts by identifying the problem as they see it, their thoughts about the problem, their emotions surrounding the problem, and their physical feelings at the time, their actions before, during, and after the problem occurs. CBT is short term and focus psychotherapy for a wide range of psychological problems, including depression, anxiety, anger, marital problems, loneliness, panic, fears, eating disorders, uh, substance abuse, alcohol abuse, and dependence, and personality problems. And an example of how a cognitive therapy approach is used in addiction counseling is it is usually administered in an outpatient setting, clinic, or a doctor's office by a therapist trained or certified in cognitive therapy techniques. Therapy may be in either individual or group sessions, and the course of treatment is short compared to traditional psychotherapy, which is often about 12 sessions or less. The therapists consist of degreed personnel such as psychologists, clinical social workers, counselors, and psychiatrists. Therapists use several different techniques in the course of cognitive therapy to help patients examine thoughts and behaviors. This includes uh, val- um, validity testing, and the therapist there, they ask the patient to defend his or her thoughts and beliefs. If the patient cannot produce objective evidence supporting his or her assumptions, the invalidity of faulty nature is exposed. Cognitive rehearsal. The patient is asked to imagine a difficult situation he or she has encountered in the past, and then works with the therapist to practice how to successfully cope with the problem. When the patient is confronted with a similar situation again, the rehearsed behavior will be drawn on to deal with it. Guided discovery. The therapist asks the patient a series of questions designed to guide the patient towards the discovery of his or her cognitive distortions. Journaling. Patients keep a detailed written diary of situations that arise in everyday life and thoughts and emotions surrounding them and the behavior that accompany them. The therapist and patient then review the journal together to discover maladaptive thought patterns and how these thoughts impact behaviors. They also sometimes are given homework in order to encourage self discovery and reinforce insights made in therapy. The therapist may ask the patient to do homework assignments. This may include note taking during a session, journaling, review of an audio of a patient's session, or reading books or articles appropriate to the therapy. They also may be more behavioral focused, applying a newly learned strategy or coping mechanism to a situation, and then recording the results for the next therapy session. Or modeling. Modeling is a role playing exercise, and this allows the therapist to act out appropriate reactions to different situations. The patient can then model this behavior. Okay, during the cognitive therapy sessions, a trained therapist teaches the tools of cognitive therapy. If a patient makes small changes in their thinking and behavior every day, then over time, these small changes lead to lasting improvements in mood and outlook. There are both advantages and disadvantages with this therapeutic approach, CBT, while working with individuals receiving substance abuse treatment. The advantage about cognitive behavioral therapy is that it actually works. Numerous outcome studies show that CBT is as or more effective than medication in the treatment for substance, depression, anxiety, obsession, and other fears, and does not have the negative side effects of medication. It is often superior to other treatments in preventing relapse because patients learn self help in therapy. On the other hand, even though cognitive behavior therapy has many benefits, when it's used as a part of an addiction treatment plan, a few limitations of the technique need to be considered. The disadvantage of CBT works best on motivated clients. Also, some clients mistakenly conclude that bad things have happened to them because they have had bad feelings and thoughts. Cognitive behavior therapy can play an important role in your addiction treatment plan. Combined with other forms of therapy and support, CBT can help you break the cycle of unhealthy thoughts that fuel addictive behaviors. Overall, the approach can be effective in counseling and treating addiction. CBT, cognitive behavior therapy, is an evidence based form of therapy. It helps the patient identify and unlearn addictive behaviors and replace this with healthier behaviors that puts them on the path toward recovery, change the way they think, feel, and behave now. CBT is action oriented, practical, rational, and it helps the patient gain independence and effectiveness in dealing with real life issues. Research study indicates that the skills individuals learn through cognitive behavior approaches remain after the completion of treatment. Current research focuses on how to produce even more powerful effects by combining CBT with medications for drug abuse and with other types of behavior therapies. A computerized based CBT system has already been developed and has been shown to be effective in helping reduce drug use following standard drug abuse treatment. Thank you.